It starts subtly. A forgotten name. A misplaced set of keys. You call it a senior moment. But then it grows. Your mother, once sharp, struggles to follow a conversation. Your father, once a handyman, seems lost in his own home. You watch, helpless, as the person you know fades into a fog of confusion. The immediate, terrifying thought is dementia. Alzheimer's. You brace for a devastating diagnosis. But what if it's not that? What if the cause isn't an irreversible disease, but something else entirely? Something hidden in plain sight, right inside the medicine cabinet. If this story sounds chillingly familiar, or if you care for an aging loved one, you need to watch this entire video. Hit that subscribe button now, because the information we're about to reveal could be life-altering. This isn't an isolated incident. It's a silent epidemic. Millions of seniors are experiencing this rapid onset of confusion and memory failure, leaving families scrambling for answers. Doctors, with the best intentions, often attribute these symptoms to the natural aging process or the early stages of a neurodegenerative disease. It's a common conclusion, but one that can lead to unnecessary heartbreak and a failure to identify the true, and often reversible, culprit. The source of this mental fog often resides where we seek relief: the pharmacy aisle. We're talking about a specific, widely used class of medications, many of which don't even require a prescription. They are the go-to remedies for common ailments. Think of the pills for seasonal allergies, the syrup for a nagging cough, the tablet that helps you fall asleep, or even drugs for an overactive bladder. They've been on the market for decades, trusted by generations, and recommended by doctors. Their perceived safety is their greatest disguise, allowing them to operate under the radar, while potentially wreaking havoc on the delicate chemistry of an aging brain. How can something so benign cause such profound problems? The mechanism is simple and insidious. Imagine a vital neurotransmitter in your brain, a chemical messenger responsible for memory, learning, and focus. It's what allows your thoughts to flow clearly. Now, imagine a blocker. The active ingredients in this specific class of drugs act as these blockers. They cross into the brain and physically obstruct the receptors this messenger needs to connect to. Communication slows to a crawl. The result is a chemically induced brain fog, a state of confusion that mimics the symptoms of dementia so perfectly that even professionals can be fooled. The brain isn't broken. Its communication lines are being jammed. This leaves us with a terrifying puzzle. A widespread neurological crisis is being mistaken for an irreversible disease. The prime suspect is a group of common, trusted medications found in nearly every home. The weapon is a chemical blockade that starves the brain of a crucial messenger. The critical questions are: what are these specific drugs? How can you identify them on a label? And why isn't this front-page news? The answers are closer than you think, hiding behind brand names you know and trust. In the next part of this investigation, we will pull back the curtain. We are going to name them, one by one. The hidden danger we hinted at has a name. It's not one specific pill, but a vast and varied class of drugs, known as anticholinergics. The name itself is a direct clue to its function. Anti, meaning against, and cholinergic, which refers to a vital chemical messenger in your brain. For decades, these drugs have been celebrated staples of modern medicine, effectively treating everything from allergies and insomnia to depression and incontinence. They are common, widely available, and often taken without a second thought. But this effectiveness comes at a hidden cognitive cost, a silent toll on the machinery of our minds. A price that millions are paying without even realizing the transaction is taking place. Their primary, intended effect is often accompanied by an unintended, and far more sinister, side effect on the brain. To understand how this damage occurs, we must first understand their target, a neurotransmitter called acetylcholine. Think of acetylcholine as the brain's master conductor for learning, memory, and attention. It's the essential chemical that allows your neurons to communicate effectively. When you form a new memory or focus on a complex task, it's acetylcholine that's firing between synapses, unlocking cognitive pathways. Imagine your brain's receptors as a series of intricate locks. Acetylcholine is the perfectly crafted key that fits these locks, opening the doors to thought and recall. Anticholinergic drugs act like a piece of gum deliberately jammed into that keyhole. They don't destroy the lock or the key, but they physically block the connection, preventing acetylcholine from doing its job. The signal is sent, but it never arrives. This chemical blockade is not some rare, obscure phenomenon. The culprits are hiding in plain sight, likely in your own home right now. The most common offenders are found in the allergy aisle. The active ingredient in Benadryl, diphenhydramine, is a potent anticholinergic. The same goes for many motion sickness pills, like Dramamine, and popular over-the-counter sleep aids, like Zaquil or Unisom. People take these to stop a runny nose or to get a good night's sleep, completely unaware that they are simultaneously running a blockade on their brain's most important chemical for memory. The temporary relief they provide from one symptom comes with a dangerous and often unnoticed side effect: the systematic disruption of cognitive function. The problem extends far beyond the over-the-counter aisle and deep into the world of prescription medications. Many drugs prescribed for an overactive bladder, such as oxybutynin, are powerful anticholinergics. Certain older types of antidepressants, known as tricyclic antidepressants like amitriptyline, also carry a heavy anticholinergic load. Even some medications for muscle spasms or stomach cramps operate on this same principle of blocking acetylcholine. This creates a perilous situation, especially for older adults who are often on multiple medications prescribed by different specialists. A cardiologist, a urologist, and a psychiatrist might each prescribe a medication without realizing that the patient is now facing a triple dose of anticholinergic burden, a cumulative chemical assault on their brain. This isn't just a theory. It is a conclusion backed by extensive, alarming research. A landmark study published in JAMA, Internal Medicine, called the Adult Changes in Thought Study, tracked thousands of individuals for over 7 years. The findings were unambiguous. Participants taking the most common anticholinergic drugs at the highest doses for the longest duration, equivalent to taking a daily dose for more than 3 years, had a staggering 54% higher risk of developing dementia than those who took none. The research even showed physical evidence. Post-mortem examinations revealed that those with high anticholinergic use had greater brain atrophy and more of the pathological hallmarks associated with Alzheimer's disease. The link is no longer a matter of speculation. It is a scientifically validated warning. The initial impact of these drugs is rarely a dramatic, sudden event. It's a subtle creep, a slow fog easily mistaken for normal aging. It begins with small lapses, walking into a room and forgetting why, struggling to retrieve a common word, or rereading a paragraph because your focus drifts. These aren't innocent senior moments. They are often the first whispers of a brain struggling against a chemical blockade. This insidious onset is what makes the anticholinergic effect so dangerous. It doesn't announce its arrival. It sneaks in, eroding cognitive function, leading people to wrongly attribute these changes to stress or just getting older. As exposure continues, these whispers can grow into alarming shouts. The occasional brain fog thickens into persistent confusion. Short-term memory becomes unreliable, making it hard to recall recent conversations. Simple tasks that were once second nature, like following a recipe, suddenly feel like monumental challenges. In severe cases, particularly in the elderly or vulnerable, the effects can escalate to full-blown delirium. This can manifest as significant disorientation, incoherent speech, and even frightening hallucinations. This isn't just feeling off. It's an acute cognitive crisis, induced by medications meant to provide relief. This escalation leads to a critical concept: the anticholinergic burden. This isn't about one pill, but the total, cumulative impact of all such drugs in your system. Think of a scale. One medication for allergies might not tip it, but add another for an overactive bladder, and a common sleep aid, and the scale becomes overloaded. The brain's acetylcholine system is now assaulted from multiple directions. If you're finding this information valuable and believe it could help someone, please hit the like button and subscribe. It helps spread this vital awareness. This hidden accumulation is the true threat, a silent overload with devastating consequences. The danger of this burden isn't just how many drugs you take at once, it's also how long you take them. The risk is cumulative over time. Taking even a single low-dose anticholinergic medication consistently for years can contribute significantly to cognitive risk, potentially causing more long-term harm than a high dose for a few days. The brain is resilient, but not invincible. This sustained low-level chemical interference slowly chips away at neural pathways. The damage isn't obvious month to month, but over years, it can lead to tangible, structural changes, weakening connections essential for memory and clear thinking. Ultimately, this cumulative burden combining multiple drugs and long-term use transforms a temporary side effect into a permanent catastrophe. The research is clear. A high anticholinergic burden over time is strongly linked to an increased risk of irreversible dementia, including Alzheimer's. The brain isn't just being temporarily impaired. It's being fundamentally damaged in a way that mirrors the disease process. It's a terrifying thought that seeking relief from common ailments could inadvertently accelerate the very cognitive decline we fear. the line between temporary confusion and permanent cognitive loss becomes terrifyingly thin, highlighting the urgent need to understand our total, long-term chemical exposure. This accumulation of risk, this cognitive burden, can feel overwhelming. But this knowledge is not meant to induce fear, but to empower. It is the key that unlocks a door to proactive health management. The most encouraging part of this story is that for nearly every condition treated by a high-burden anticholinergic drug, safer alternatives exist. You are not trapped. This isn't about choosing between treating a condition and protecting your brain. It's about finding the right way to do both. The medical landscape has evolved, and understanding this evolution is the first step toward making informed decisions with your doctor. Let's get specific. For allergies, instead of first-generation antihistamines like diphenhydramine, consider the second-generation options like loratadine or cetirizine. These were engineered to not cross the blood-brain barrier as easily, targeting allergy symptoms with a significantly lower risk of causing brain fog. When it comes to insomnia, the paradigm has shifted away from medication entirely. The gold standard, first-line treatment is now cognitive behavioral therapy for insomnia, or CBT. This proven therapy addresses the root behaviors and thoughts that disrupt sleep, offering a permanent solution without the cognitive risks of anticholinergic sleep aids, which simply mask the problem. This pattern continues across other conditions. For an overactive bladder, older drugs like oxybutynin carry a high anticholinergic load. Newer medications, like mirabegron, work through a different biological pathway that avoids blocking acetylcholine, offering relief without the cognitive price tag. Non-pharmacological strategies like pelvic floor exercises are also highly effective first-line treatments. In mental health, older tricyclic antidepressants have been largely superseded by modern SSRIs and SNRIs. These newer classes of drugs were specifically developed to have a much cleaner side effect profile, carrying a significantly lower, or even zero, anticholinergic burden, making them the standard of care for long-term brain health. Armed with this knowledge, the next step is a crucial conversation. This is where we introduce deprescribing, a collaborative medical process to thoughtfully reduce or replace medications that may be causing harm. It's not about defiance, but about partnership. To prepare, make a comprehensive list of everything you take, including over-the-counter products and supplements. Note any cognitive symptoms you've experienced, like brain fog or memory slips. Frame your conversation as a question, not a demand. I'm concerned about my long-term brain health and the concept of anticholinergic burden. Could we review my medications to see if there are safer options? This approach opens a dialogue for shared decision-making. However, and this point cannot be overstated, never stop taking a prescribed anticholinergic medication abruptly on your own. This is not a do-it-yourself project. Many of these drugs require a careful medically supervised tapering process to avoid severe rebound symptoms or the dangerous worsening of the underlying condition. Abruptly stopping can be physically and psychologically jarring. The goal is always a safe, guided transition, not a reckless halt. Your conversation with your doctor is therefore not just a suggestion. It is the mandatory, essential step to making any change. Think of this knowledge as the map, but your doctor is the experienced guide to navigate the terrain safely. After successfully navigating the crucial conversation with your doctor, the most pressing question undoubtedly emerges. Is the damage reversible? Can the fogginess, the memory lapses, and the slowed thinking be undone? The answer is nuanced, but it begins with a hopeful note. For many individuals, the most immediate and distressing cognitive symptoms are directly tied to the drug's active presence in their system. This is the short-term effect. When the anticholinergic medication is carefully tapered and discontinued under medical supervision, a significant number of people report a remarkable lifting of this brain fog. They experience a return to mental clarity, improved short-term memory, and a quicker processing speed within weeks or months. This initial recovery is the brain recalibrating, freed from the chemical blockade of acetylcholine. It's a powerful demonstration of the brain's immediate resilience, and offers a tangible reason to take action. However, the conversation becomes more complex when we consider the long-term implications, especially after prolonged use of these medications. The scientific link between a high cumulative anticholinergic burden and an increased risk of dementia raises a more serious question about permanent structural changes in the brain. While stopping the medication is the single most important step to halt any further progression of damage, reversing years of potential subtle injury is a different challenge. Think of it like this: you've stopped the leak, but now you have to deal with the water damage. The current evidence suggests that, while the direct, Drug-induced fog can lift any underlying neurodegenerative process that may have been accelerated, is unlikely to be fully reversed by cessation alone. This isn't a cause for despair, but rather a call for a new, proactive strategy. The goal shifts from simple reversal to aggressive brain support and building resilience against future decline. This is where you move from a defensive position, removing a harmful agent, to an offensive one, actively fortifying your brain. The concept of cognitive reserve becomes paramount. This is the brain's ability to withstand neurological damage without showing clinical symptoms, and you can build it. Nutrition is your frontline tool. Adopting a diet like the Mediterranean or Mind diet, specifically designed for brain health, can be transformative. These eating patterns are rich in antioxidants from berries and leafy greens, which fight cellular damage. Omega-3 fatty acids from fish, which are critical components of brain cell membranes, and polyphenols from nuts and olive oil, which reduce inflammation. This isn't about a single superfood, but a synergistic effect of whole foods that provide the raw materials your brain needs to repair itself and function optimally. You are literally feeding your recovery. Beyond diet, physical and mental activity form the other two pillars of a robust brain health strategy. Consistent aerobic exercise, even just brisk walking, has been shown to increase blood flow to the brain, stimulate the growth of new neurons in the hippocampus, the brain's memory center, and reduce systemic inflammation, a key driver of cognitive decline. It's one of the most powerful interventions available. Simultaneously, you must challenge your brain to build new connections. This goes beyond crossword puzzles. It means engaging in complex, novel activities. Learn a new language, pick up a musical instrument, take a challenging course. Engaging in rich social interactions also provides potent mental stimulation. This combination of physical and mental exercise acts like a comprehensive maintenance program, strengthening existing neural pathways and creating new ones, making your brain a more resilient and efficient organ. Ultimately, the journey back to cognitive wellness is a two-part process. The first, and most critical, is the medically-guided removal of the offending chemical burden. The second is a lifelong commitment to a proactive, brain-centric lifestyle. While not every effect of long-term use may be completely reversible, you possess a profound ability to halt further damage and significantly improve your brain's function and resilience for the years to come. Remember, this information empowers you, but it never replaces the guidance of a healthcare professional. Now that you understand the hidden dangers in the medicine cabinet, it's time to look at the silent risks on your plate. In our very next video, we expose the top 5 so-called health foods that are secretly sabotaging your brain. The truth about what's in your pantry will shock you. Click the video on your screen right now to continue your journey to a sharper mind.